Well, thank you. This is Mayor Robert Garcia. Today is April the 24th. It's Friday, and we have a lot to report today. I want to thank you for joining us again. Después de las preguntas, we're going to go to a Spanish translation as well. And so I want to thank Teresa Ayala Castillo from the Health Department and Paola, who's right behind us, who's doing our translation in ASL. So thank them. I want to begin also just wishing, I know we have a lot of members of our community that are celebrating Ramadan. And so Ramadan Mubarak to everyone that celebrates. We know this is a very important celebration to all of you during this time of year. And so we wish you well in a healthy year and a healthy Ramadan. Let me begin with some general updates. We have, as of today, a total of 540 cases in Long Beach. This is residents that have tested positive for COVID-19. We know about 313 have recovered. So of the 540, about 313 have recovered. That's really good news, of course. We've had a few more deaths. Unfortunately, we're at 29 deaths now across the city. This is obviously very tragic for the families involved, and we're monitoring many more people that are in critical condition, of course, because of COVID-19. So this continues to be a serious challenge, and we're going to talk a little bit about that today. I also want to note, to be clear, I've heard some conversation about how dangerous COVID-19 is in comparison to other ailments or other types of health conditions, and we are on track in Long Beach for COVID-19 to be the leading cause of death in just these few weeks than of any other form of death within a given year. And we're talking about things like murders, like car accidents, and so we are right there. And so this pandemic and this virus in Long Beach will be the leading cause of death for us as a community, and which is why we're taking it so seriously. Want to talk about first testing. I mentioned and have been mentioning that we are dramatically expanding our testing capacity. That continues to happen, and we're really proud of the health department and all of our teams through our testing centers. We're all aware that Long Beach is operating multiple testing centers. We are operating a drive-through testing center at the health department that's really by appointment and first responders. We have another one at Long Beach City College, which also has a rapid assessment clinic that is seeing folks that are uninsured, that need access to health care, whether people are documented or not documented. It's going to see everyone in our community at Long Beach City College. There's a drive-through testing site there. And of course, we have our testing sites at Jordan High School, at Cabrillo High School, and at St. Mary Medical Center. So when you look at this whole level of testing, we have the capacity to be doing over 500 tests a day. And we are seeing every day more and more tests coming online. So just for us, through our drive-through testing sites, which are, of course, accessible through our website, and you can go to longbeach.gov, the COVID page, and then you click testing, and there's a process there. We have seen about 3,100 tests. So we've done 3,100 tests through our drive-through centers. When you add our private partners at our testing labs, it's an additional 2,700 tests that we've completed so far. So in total, Long Beach has completed approximately 5,800 tests. And that is obviously a number that we want to get even higher. And we are seeing more and more folks. So please, if you have symptoms, get tested. But we're doing more than that. We're working right now with our partners at the state and the county to hopefully expand testing again and create even additional spaces to do testing. And that is on its way, and we're optimistic about that. And we are going to be shifting and have begun to shift who we test. And I want to just briefly mention that. So we have, from day one, followed CDC protocols. We've also partnered with our county to ensure that we're testing the people that need it the most. And so we have begun, of course, by testing. We really focused on seniors, and we focus on folks that are symptomatic, as we need to continue. That needs to be the main component. But we are also now, starting today and in these next few days, we're shifting to open up that testing process just a little bit more. And we are now testing all nursing skill facility centers, both patients and workers that need a test or that want a test. We want to test them. And so we're beginning to partner with all of those skilled nursing centers and providing tests, whether they're symptomatic or whether they're not symptomatic. That is a shift and a change, but one that we believe is the right thing to do, especially because we know most of our cases are at these centers. And we're going to take that in the days ahead, more steps forward. And so you'll begin hearing us. We're going to be, and we have started to do this, and we're going to do more of bringing in and testing first responders and other critical workers that may not be symptomatic, but that are interacting with the public on multiple occasions or that might have been exposed. And so while we have had success in doing some large-scale testing to symptomatic folks, we are now going to be looking at some key areas, some essential workers that need to be tested that might not be symptomatic. And so please, again, you can contact the health department. Our 570 info line is there for everyone to use, and our testing website will be adding more information as we go in the days ahead. Here's why it's important that we ease into this. You may have heard that other parts of the state have begun testing individuals that are not symptomatic, which we think is great. We support that. But some of those similar locations have seen huge burdens and backlog. And so a couple of those locations had initially 48 to 3-day turnarounds on tests. And when they expanded to non-symptomatic individuals, their turnaround time dramatically increased, a week plus. And so we want to make sure that as we transition, that we're doing it the right way and that we can still make sure that folks that have symptoms are at the top of that list. And that's especially critical because we know that even in Long Beach, we've had delays. Well, we had some delays at the Long Beach City College Center with our testing partner on that site. There was a national, as you know, backlog that's been going on, a statewide backlog. And so we've addressed those issues now, but we don't want that to happen again. And we want to make sure that we're doing this the right way. So I'm just sharing with you, we're easing in to testing folks that are not symptomatic, but it's going to take some time because the symptomatic folks are the priority. And again, longbeach.gov, the COVID website, is the testing center. And as we move to this next phase of reopening the city and the economy, testing is more important than it's ever been. I want to transition to talking to you about what we're doing for small business. The City Council has been working really hard, and I want to commend them for their incredible work, especially around economic recovery. They have put in place an emergency microloan program that currently is providing $10,000 loans and some other larger loans that have been dispersed. We have already put together, we've sent out 50 loans totaling $500,000 that have been approved, and an additional 20 loans have also been are being approved. And so these loans are going directly into small business owners, and we're increasing that day by day. We want to thank, of course, the U.S. Economic Development Administration, the Small Business Administration for these partnerships. But if you're a small business, on the COVID-19 site, there is a small business link and page where you can go and apply for some of these small loan programs. And we hope that we can do a lot more of those in the days ahead. Want to mention our economic recovery process. So as you're all aware, there's a lot of conversation about how and when to reopen the Long Beach economy and some of our open spaces. And there's multiple things happening. One is we have a economic recovery advisory group that actually had their first meeting today, led by former Mayor Bob Foster. They are coming up with a series of recommendations on how we reopen parts of the economy that are critical. They are going to be producing a report to the city, the council, our staff, to really guide us in that work. And I want to thank them for volunteering and doing that work. We also have the City Council themselves, the Economic Development Council Committee is beginning some hearings starting next week, where they'll bring together folks from the community to hear how we can get this economy kick-started again. And I want to thank those committee members and for their work. And I believe to Councilman Rex Richardson, who's the chair, Councilwoman Stacey Mungo, who is the vice chair, and to Councilmember Roberto Uranga. I want to thank them for that work, and I know that work begins next week. And so I encourage you to follow that council committee. They're all, along with all the council members and our team, all putting our heads together to figure out how and when we reopen the economy. And I just want to make sure that we know that the most important thing is public health. I'm hearing from a lot of folks that want to, reopen X, Y, or Z, and I understand. You're frustrated. I'm frustrated. Small business owners are losing their livelihoods. Workers are out of work, don't know how they're going to pay the rent, and we are all getting through this together. But I will make sure that everyone understands, and especially this upcoming weekend, that our safer at home policies are still in place. And until we are confident that we're not going to put people's lives in danger and cause the deaths of other people, we're going to be very cautious as we reopen this economy. And you are going to see changes in the days ahead and announcements in the days and weeks ahead, but we're going to do this in a way that's very cautious. And what could that look like? It could look, for example, where we might have certain types of small businesses or industries that begin to reopen with a set of conditions that makes them really enforce physical distancing and makes them safe. And once those are open, we'll see how that works for a week or 2 weeks until we open another group of small businesses or public spaces, because we're going to have to trace, we're going to have to ensure that testing is in place and that we're not overburdening our hospitals. So that's something that we have to look forward to, but we're not there yet, but we are getting close. And so please be patient with us. We're working very closely with Governor Newsom on his recovery strategy. We are not going to get ahead of everybody else. We want to do this in a way that is safe. And I know that frustrates some people. I've been getting many of those messages, some very angry, and I am sorry that some folks feel that way. But at the end of the day, it's our responsibility and my responsibility to keep our city and the public safe. And so we're doing the right thing, and we'll continue to put information out so we can all take care of each other as a community. And I want to note on that point, we are entering a very critical weekend. And I think it's important for us to remember a few things about our safer at home order. First and foremost, regardless of what chatter you might be hearing, our safer at home order is in place today and through this weekend, and until we change anything through May the 15th. That means that beaches are closed. That means that parks are closed unless you are walking through the park or running through the park. That means that parking lots at beaches and our parks remain closed. That means that only non-essential work is happening. And so I understand that Orange County or Riverside County or other folks or other places might be doing different things, but we're not Orange County and we're not Riverside County. We are living in a community that is more dense, that has different set of challenges, and I believe a community that is responsible and looking out first and foremost for the safety and well-being of the people that live here. And so please know that I just earlier today I was on a call with all the 88 mayors of every city in LA County. We are all working together along with the governor and all the mayors of California to do this in a way that's safe and the appropriate way. And so please know that May 15th is the day that we have our order in place until. Could there be changes between now and then? Absolutely. But that's not happening this weekend. And until we make decisions that are based on health and science, what we have in place is for the protection of the public and our nurses and doctors. I can't tell you, when I talk to a nurse or a medical professional, they're pleading with us to please continue to do what we're doing. So they don't have the luxury of staying at home. They're working in the hospitals every day, scared to transmit COVID-19 to their parents or their family or their kids. They're seeing more tragedies in their workplace, and they need our support. And so please continue to follow our order and do the right thing and make sure your family stays safe as well. Remember, there's a lot about this disease we still do not know. And there's a lot of misinformation out there about what works and doesn't work. And we want to make sure we give you the right information. So that's important. So please, I know 95 to 99% of you are going to follow the rules and do the right thing. And it's unfortunate that a small percentage of folks won't do the right thing. And so I implore for the majority of us to do the most good and stay home and save lives. Before I transition over to Emily Holman, who is with our health department, and she really oversees a lot of our disease prevention and what we're doing here with COVID, I want to end with a really positive note as well. Today wraps up the first 2 weeks of our World Central Kitchen program. And for those that may be following this program, a wonderful, of course, well-known chef, Jose Andres, who is a global phenomenon, has started this organization with friends and supporters that is going around the country and world and providing direct food for seniors and vulnerable populations. In Long Beach, in just these last couple of weeks, we have been able to prepare over 12,000 meals for seniors in senior buildings, thanks to the amazing work of the Ordinaire, one of our restaurants downtown, and Lola's in Bixby Knolls. Those two restaurants are preparing about 1,100 meals a day to seniors in need across the city in some of our senior buildings. And so what's happened is we've been able to put these cooks and these chefs back to work. These restaurants are open, and they're putting out these meals. I'm really happy also today to be able to announce and say that our World Central Kitchen partnership is expanding. We're adding the Breakfast Bar, which is a well-known spot in the downtown area, in the East Village. They're joining our World Central Kitchen program, and we're expanding the amount of meals that we do daily. And more good news is that we continue to expand, and we're going to expand that program even more to ensure that there are no seniors in our community that are hurting for a meal or a hot meal and a healthy meal during this crisis. And so thank you to the Ordinaire, to Lola's, to the Breakfast Bar now, of course to World Central Kitchen, and to UPS, because UPS is delivering every single one of these meals for free at their cost. And thank you to UPS for this partnership. They're a great company that has a big presence here in Long Beach. And so thank you for that. I want to turn this over to Emily now, and I want everyone again to have a safe weekend. And thanks to Emily and her amazing work at the health department. Emily.
Thank you, Mayor. As Mayor Garcia mentioned, one of our main efforts continues to be controlling outbreaks at long-term care facilities. We are continuing to prioritize these outbreaks and have recently increased the number of staff assigned to work these outbreaks to be able to respond accordingly. These are facilities that the Communicable Disease Control Program and the Health Department have had relationships with for years, and we've been working on infection prevention improvements with them even before COVID started. These facilities aren't just numbers of cases or statistics to us. These administrators and nurses are our colleagues, and some of us even have loved ones in these facilities. We are doing everything we can to control the spread among this vulnerable population. We have been able to supply them with PPE within hours of their request thanks to our EOC. We consult with our administrators at all hours of the day and night and weekend. We help with patient placement and isolation and quarantine within the facilities, and we have been prioritizing testing for staff and residents in these facilities since the beginning. One aspect to our outbreak response that we have recently added is to test all exposed residents and staff who have been exposed to COVID, whether they're symptomatic or not, as was recently recommended by the California Department of Public Health. We are currently ramping up these testing efforts in these facilities and are aggressively testing staff and residents to quickly understand the extent of COVID-19 in the extent to which it has spread in these facilities and isolate patients accordingly. As our testing capacity continues to expand in Long Beach, we will also be expanding our testing efforts within our long-term care facilities in Long Beach. Also, as the mayor described, we will begin sharing more detailed information about cases in these facilities. We have listed facilities that are currently experiencing outbreaks, and we define an outbreak as having 2 or more active cases. As we increase our testing capacity, we are also planning for a surge in contact tracing for those residents who test positive. This involves following up with anyone that a confirmed case has had contact with while they may have been infectious. Contact tracing involves communicating with those who have identified to have come into contact with cases and monitoring them for a 14-day period. Once stay-at-home orders begin to relax and people begin to return to work and school, contact tracing will be even more crucial in limiting the number of cases in Long Beach and stopping the spread of COVID. We are working to build our surge capacity within the health department by getting more contact tracers trained and ready to hit the ground running once these stay-at-home orders start to relax. And finally, I'd like to take a moment to recognize this week as National Medical Laboratory Professionals Week, an annual celebration of medical laboratory professionals. Our health department and local lab staff have played a crucial role in our COVID-19 response, and I personally want to thank them for all their hard work, their current efforts, and for many other laboratory services that they provide to the city, even unrelated to COVID. Thank you so much for your service to this community each and every day. In conclusion, please remember that for all the latest information, continue to check our website, longbeach.gov/COVID-19. You can also follow us at Long Beach City on Facebook, Twitter, and Instagram. Thank you.
Thank you. And actually, I missed one thing. I think Emily was referring to it, but I want to make sure I get back to it. I actually. So let's expand on one thing, Emily. So I actually missed. There have been questions, and I know that media has asked a couple questions about how we report at our skilled care facilities, at our nursing homes. And we have been careful to follow, of course, kind of the state guidelines and some of the kind of national standards. But we are going to be providing more information on these facilities, and so we're going to find ways so that we can actually share the number of cases of staff and residents at the individual long-term care facilities. So that data we will be releasing it. I think we're going to start doing that today, I believe.
Yeah, I think so too.
So I think that today, I think it's either out or will be out. And our plan is to do this in 2 phases. So we're going to be releasing a lot more information today about certain facilities and the numbers, and then we are creating a new way of reporting it, which I think over the course of the next day or so, a few days, we'll be putting and clarifying even more information on these individual nursing homes. And one of the reasons is because, from what I understand, what the health department said is right now we're working with each individual care center to make sure that they are aware that this information is being released to the public, and I believe it should be, and I believe it's the right thing to do. And so that information is being put out. And so again, thank you to those who have inquired about that. And I want to thank the health department for pushing that issue and for getting that information out to those that need it. And so with that, we will take questions, and then we'll do our Spanish translation recap. Thank you.
Good afternoon. Our first caller is Rachel from ABC News. Rachel, are you there?
Yeah, I'm here. Can you hear me?
Yes.
Okay. So this question is for the mayor. So will there be an increase in police patrolling the beaches this weekend now that it'll be a heat wave? And what are the consequences for those that decide not to abide by the order?
I mean, yes, I mean, the police are going to be out this weekend, obviously monitoring. We know it's going to be a hot weekend. We know that people are antsy. We get that. So they will be out. Obviously, they have citation power to do what they need to do. Last few weekends have been okay. We know where some of our kind of hotspot issues are along the Bluff and Bixby Park and other locations. But our police will be out. But we know that we cannot patrol every person all the time. We just need people to be responsible. And so our police force will be out there. They will be out in full force. But we have a lot to do. And our police officers are doing a lot of things right now. And so I just ask everyone's patience and for hopefully most people to do the right thing.
All right, next up is Kelly from the Long Beach Post.
Yes, hi there. Just want to say thank you for this shift in providing more details on individual facilities. As the mayor said, it's important information. Are they going to include the number of fatalities per facility at this point? And a second part question, LA County is averaging about 40% of deaths are linked to long-term care facilities, where in Long Beach, we're seeing more than 80%, which is significantly higher. I was wondering if there is any reasoning or speculation at this point of why Long Beach is seeing such a higher death rate in these facilities.
Do you want to go first? Or you want me to go?
You can go first.
Okay. So as the question relates to the information about the locations and the deaths, so I think the answer to that is yes. But Kelly, we'll right out when this is over, we'll get that information to you. What I do know is it's going to be released in two phases. So today we're releasing a bunch of data. And then some of the care facilities have not all been connected to. And so as soon as that process is complete, then all the information will be released. So we'll get you that answer right after. But we've been pushing for as much information as possible. Certainly if LA County is doing that, we want to make sure that we're doing that. And then the second part of your question was around why in Long Beach. So obviously, I'm not a medical professional, but nor am I going to speculate. I'll just tell you what we know is that in Long Beach, like you said, a majority of our deaths are in these facilities. And so we're taking this very seriously. And we are working with all these facilities. We're at these facilities. They are doing, I can't tell you, they're doing some amazing work right now in trying to keep people safe. But that is why we have put out separate health orders just on these nursing skilled facilities, and why we continue to push on these, because it is our spot where we're seeing this real problem. Is that can someone infer that that's a positive sign that we don't have more deaths outside the system? I don't know. I mean, you have to really crunch more data to see that. Overall, I think if you look at the data on the dashboard as far as comparing us to LA County and how we're doing, I think we're doing fine comparatively. But most of our deaths are coming inside these facilities, and we have to watch that and take it seriously.
Our next caller is Philip from Q Voice News.
Hi, my question is for the mayor and for the health official. We've been hearing a lot about data and disparities within the African American and Latino community because of COVID-19 underlying conditions that are in the community. But there seems to be one community that is being neglected and not included in information, and that's the LGBTQ community. Nobody's tracking this. And even in Long Beach, when there's a demographic breakdown, we have Asian American, Latino, Black, Hawaiian Islander. the gay community is not included. We are included with other sort of surveillance and tracking, for example, HIV, but not for COVID-19. So my question is, why are we not being tracked? A month into this crisis, more than a month, we're still not being tracked. And on what date will the tracking begin?
So maybe we can both answer that. I think, well, first, there are folks in the health department actually working on within the LGBTQ population. I've personally talked to some of our local nonprofits specifically about this issue. We know that LGBTQ folks, especially in our community, as it relates to people living with HIV, have immune systems that are compromised in many cases, and that need additional support and need additional care. So that is something that we've had conversations about, and that we are actually monitoring. As far as why that category itself isn't in the tracker, I'm not sure if, Emily, you have an answer to that, but if we don't, we can make sure that the health team gets back to the Q News.
Yeah, we can look into that.
Okay,
Yeah.
we'll look into that and we'll get back.
And our last caller is Emily from Southern California News Group.
Hi, thank you for having me. My question is Long Beach doing its own projections regarding the spread of the coronavirus? And if so, does it show what would happen if the current government orders were lifted?
I mean, we want to go ahead first, Emily? No.
Locally, we have looked at that. We also work very closely with the state Department of Public Health and their projections. And, they have entire teams working on these projections in different parts of California because, of course, although we're a city health jurisdiction, everything around us sort of affects what happens here in Long Beach. And so there have been discussions statewide sort of about when to lift, stay-at-home orders and sort of what would happen at these various points throughout. So that is something that we consider and discuss.
Absolutely, and I personally have seen modeling for the city. If you go out to our emergency operations center here in the city where most of our team is at, they have those models. I mean, they're looking at the modeling of effects of flattening the curve and what, infection rate, when you look at data around infection rate or positive rate. So that is all actually being tracked. And the simple answer is, of course, if tomorrow we lifted our stay-at-home, safer-at-home restrictions, the infection rate would go up and we'd have more deaths. That is what would happen. And so, and you don't need to be a scientist or a doctor to know that information. And so the question moving forward is, how do we continue to flatten this curve? And you're seeing right now in California, I mean, people are anxious, I understand, but are we following what the data is saying? We're having the highest numbers of deaths in one day are happening right now. When you look at statewide, you look at the county, they've had, I think, 4 or 5 days in a row of these huge numbers of deaths countywide. And so this idea that we're somehow over the hump is false. And I think we have to be very serious that, yes, are we flattening the curve? Absolutely. But we have to still create that capacity in our hospitals to be open and have enough breathing room so that give everyone enough time to get better, to continue working, to getting more people tested, giving time for these treatments and vaccines to kick in, all these questions and conversations around antibody testing. That is happening. We're trying to give space to these amazing technology firms that are working on putting together apps and technology to do tracing and to be able to follow an individual and where they are. There's all sorts of things happening, but it takes time. And so I just encourage people to continue to be patient, and which I know is a hard ask, but we have to continue to do that. Any other questions? Okay. Well, we're gonna do a recap en Spanish y también un recap en español y gracias por tu paciencia también. So, Teresa.
Buenas tardes. Hoy es el 24 de abril. Muchas gracias por estar con nosotros este día. Primero quiero reconocer que anoche comenzó Ramadán. A nuestros residentes que celebran, nosotros sabemos que esta pandemia ha cambiado sus tradiciones y apreciamos sus esfuerzos en continuar siguiendo las órdenes de salud. Tenemos mucha información para compartir con ustedes, pero primero me gustaría comenzar con una actualización de nuestros números. Hoy tenemos 540 residentes que han recibido pruebas positivas de COVID-19 y 313 que se han recuperado. Y lamentablemente tenemos 29 fallecidos. Esto incluye 2 más personas desde el miércoles. Las 2 personas estaban en sus 80s y tenían condiciones crónicas. Nuestra capacidad de pruebas ha crecido desde que comenzamos el 19 de marzo con la primera clínica en el Departamento de Salud y nuestra capacidad sigue creciendo. Hasta hoy tenemos un total de 3,100 pruebas hechas en nuestras clínicas de autoservicio. Junto con las pruebas por laboratorios privados, han habido aproximadamente 5,800 pruebas hechas en la ciudad de Long Beach. Las pruebas están disponibles para personas con síntomas como tos, fiebre y falta de respiración, y personas de mayor de edad. Para hacer una cita, para el mismo día o el siguiente día, por favor llamar al 562-570-4636 o ir a la página de internet de www.longbeach.gov/COVID-19. Hemos escuchado que muchas de ustedes que se han hecho la prueba del coronavirus siguen esperando los resultados. Queremos pedirles que por favor tengan paciencia. Con el gran número de pruebas también ha aumentado el tiempo que toma en recibir sus resultados. Les aseguro que estamos trabajando para resolver estos problemas porque sabemos que esta información es importante para todos y antes de abrir las pruebas a personas que no tienen síntomas. Seguimos buscando maneras de cómo reunir y proporcionar datos y información sobre los casos en centros de cuidado de largo plazo y esperamos tener más información siempre y cuando podamos proteger la identidad y privacidad de estos residentes. Le tendremos más información sobre este tema más adelante. También tengo una información sobre préstamos. Con tanta angustia económica, me da un placer en anunciar algo positivo que estamos haciendo por nuestros negocios aquí en Long Beach. Nuestro programa de emergencia de préstamos está proveyendo préstamos de $10,000 a negocios pequeños y a negocios sin fin de lucro que no pueden calificar para préstamos del gobierno federal. Hemos recibido 100 solicitudes y 50 préstamos han sido aprobados y 20 préstamos ya han sido distribuidos. Como he mencionado varias veces, nosotros vamos a usar la mejor ciencia y consejo médico cada vez que hacemos una decisión para la salud pública, incluyendo cuándo vamos a relajar nuestros órdenes de salud y demás seguros en casa. Cuando el tiempo llegue de abrir nuestra economía, lo vamos a hacer en una manera responsable y segura. Esto va a requerir que usemos nuevas e innovadoras ideas con un enfoque en la salud pública. El grupo dirigido por el exalcalde Bob Foster va a examinar la información médica, económica e incluso social disponible para recomendar protocolos para el reinicio de la economía de Long Beach. A este momento no tenemos un plan específico para reapertura de la ciudad, pero sé que este plan va a ser cuidadosamente calculado y en coordinación con el Estado, y agradecemos al gobernador Gavin Newsom por su increíble liderazgo durante esta crisis. Nuestras órdenes de salud están vigentes hasta el 15 de mayo. Por favor, recuerde que esta orden es para proteger a sus familias y todos los residentes de Long Beach. Nuestras playas permanecerán totalmente cerradas y nuestros parques solo están abiertos para caminar a través de ellas como una forma de actividad física. Nuestras órdenes de salud están vigentes por una razón muy importante: salvar vidas y evitar que esta enfermedad mortal se propague aún más. Finalmente, quiero agradecer al World Health Kitchen, Cocina de Salud, por sus esfuerzos de nuestra asociación con ellos. Gracias a los esfuerzos de esta organización, restaurantes y negocios locales hemos repartido 1,100 comidas todos los días. Hasta hoy hemos cocinado y entregado 12,000 comidas a residentes de centros de mayores. Ahora para unas palabras de Emily Holman. Gracias, alcalde. Uno de nuestros principales esfuerzos sigue centrados en controlar los brotes en los centros de cuidado de largo plazo. Continuamos priorizando estos brotes y hemos aumentado la cantidad de personas asignadas a estos brotes para poder responder a estos casos. Hemos podido proporcionar equipo de protección personal y estamos aquí para los administradores de estos centros día y noche para ayudar a resolver problemas con colocación de pacientes, y les hemos dado prioridad a los residentes y empleados de estos centros para recibir pruebas de COVID-19. También hemos aumentado los esfuerzos de pruebas en estos centros y vamos a hacer pruebas a los residentes y personal de estos centros, aunque no tengan síntomas, y vamos a aislar los pacientes para prevenir la propagación del virus. Vamos a comenzar a compartir más detalles e información sobre estos casos y vamos a compartir listas de centros que tienen brotes. Brotes son definidos como centros que tienen más de 2 casos activos. Estamos planeando para la necesidad de un aumento de personas que puedan seguir a los nuevos casos de COVID-19. Este seguimiento de casos implica que personas que han estado en contacto con alguien que tiene una prueba positiva de COVID-19 se ha contactado y monitoreado por 14 días para asegurar que no desarrollen síntomas. Cuando las órdenes de más seguro en casa sean relajadas y las personas empiezan a regresar al trabajo y a la escuela, el seguimiento de estos casos y personas va a ser muy importante para limitar y prevenir un aumento de números de casos de COVID-19 en la ciudad de Long Beach. Finalmente, queremos reconocer esta semana como la Semana Nacional de Profesionales de Laboratorios Médicos, una celebración anual de personas de laboratorios médicos y patólogos que tienen un gran impacto en todos los aspectos de la atención médica. Gracias por su dedicación en nuestros esfuerzos de respuesta de COVID-19. Para obtener más información, recuerde de visitar nuestra página en el www.longbeach.gov/COVID-19. Muchas gracias.
Y muchas gracias. Ya los vemos en la próxima semana. And again, thanks again, and we'll see everyone for our next update on Monday. And please stay safe and save lives by staying home. Thank you.